Hi, Dr. Henry. Just wondering, will each of the indoor fitness facilities that have been closed, will they need to submit their own plan for approval for medical health officers? And do you think that can happen within 2 weeks, or is there a possibility that they could be closed longer?
Yeah, so that's a very good question. What we are doing, so we're talking about specific activities that we have learned allow this virus to transmit quite efficiently, and sometimes to larger groups of people. So that is things like group classes indoors with poor ventilation, often when we're exerting ourselves. And this is something that we are now seeing around the world. So we are looking at what are the important things that need to be in place that include smaller numbers, barriers, increased ventilation, modifications of practices to make it less risky. All of those things are being developed. We needed to stop those activities because we are seeing ongoing transmission. But we don't yet have all the right guidance in place yet because we need to understand, what are the important things from the literature and from our experiences here in BC. And that work is going on right now. So when those guidance are ready, people who want to offer those types of classes again will have to have the additional protection measures in place. And they will be reviewed by our public health teams and approved before people can start up those specific activities again. So I just want to make it clear, it's not all gyms are closed. The activities that can happen in gyms that are happening with appropriate safety measures in place can continue. It's group classes with exertion where we're seeing these types of mass spread. So yes, they will be. There's a process that we're working through right now. Once the guidance is developed, we have some websites, and that will make it public where people can submit their plans, and we have a process that will review those plans before people can offer those types of activities again.
Many people seem to be confused, for example, with why small gyms are needing to be restricted, but then spas or hairdressers and salons aren't, as an example. Can you maybe just really plain and simple explain what decisions go into deciding where we place restrictions, like what was announced over the weekend? So is it based on data from contact tracers? Is it based on other risks? Can you maybe just break it down for people to maybe understand the why? As to the weekend restrictions?
Absolutely. It's based on the data that we get about where people are getting infected, where outbreaks are happening, where clusters are exploding. And we see that in specific settings. So we were seeing it, for example, you remember in the summer, we were seeing quite a lot of transmission of cases related to people going to nightclubs and some of the bars, and so we shut those down. Actually, we worked with the industry first to put in additional safety measures, and we were still seeing transmission. So we closed those facilities. That's the type of information that we use. We look at what's happening around the world as well. We've seen that in Hamilton in Ontario, there was a spin club where, again, it was transmitted to multiple places. And what we've come to recognize is that indoor spaces with poor ventilation, where people are exercising and breathing heavily, and there's somebody at the front yelling at you, and the music is loud, the virus can spread really easily that way. Which doesn't mean they're bad necessarily, but as we've seen increased transmission in the community, those become riskier. And so that's what we have found. We have had a number of occasions where people in group physical activities indoors have spread this to large numbers of other people who've taken it home, taken it to their workplaces. So those types of real world, what we're seeing, where risk is happening, has led to the orders that we've put in place. And that's why the focus this week has been on reducing the chances of transmission in those physical activity, those group physical activity indoor settings. We have early on put in place safety protocols for hair salons, for example, and they are working. We are not seeing transmission to large numbers of people or to anybody through hair salons or barber shops when those safety protocols are in place. So you will remember we have safety plans. They're on the WorkSafe BC website, for example, where people wear masks, where you reduce the number of people, so you don't come in and wait ahead of time. You don't have people going with you when you go to your hair salon. You have one person at a time. You increase the ventilation, and those are working. So when we have these safety plans in place and they're working, we don't need to take additional measures. So it is absolutely based on what we're seeing, where we're seeing people get this virus, the situations that where transmission is occurring. So I've mentioned a number of workplaces where we're seeing some of the more workplaces like retail stores, some drugstores, car dealerships. It's not the public transmitting to workers and vice versa. What we're seeing is that people are paying attention and they're following the one-way signs and they're following the wearing the masks and they have plexiglass and other barriers in place. It's when the workers are getting together having lunch or carpooling to work together. So now we have to pay attention to those aspects of the workplace where we're seeing risk. And it becomes more apparent and more acute when we start to have higher rates of transmission in the community, which is why the focus right now is on Fraser and Vancouver coastal health regions.